January. This is Democracy Now!, democracynow.org, the War and Peace Report. As we turn now to the health bill in Congress. Well, Congress might be in recess right now, but the debate over the final shape of the health care reform bill is far from over. The $871 billion Senate bill that passed last week still has to be reconciled with the House bill. Democrats are hoping to be able to present a final version for President Obama to sign by late January or early February. Meanwhile, the progressive community is split about what to push for. Some have lambasted the Senate for removing language that would have created a government-run health insurance program to compete with private insurers. Others believe the Senate bill is the biggest expansion of federal health care guarantees since the enactment of Medicare and Medicaid over 4 decades ago and should be supported as a first step toward reform. Well, today we'll have a debate between two outspoken critics of the health insurance industry. Both support the overhaul of the nation's healthcare system, but they disagree over whether or not to kill the Senate bill. John Walker is a policy analyst at the website Firedog Lake. He's been closely tracking healthcare reform debates. He believes the Senate bill is deeply flawed and writes, quote, "This Senate bill is not a step forward for progressivism. It's a step backward. It's part of the transformation of all important public social responsibilities into a privatized profit-making machine that lives off of government money and won through a corrupt cycle of lobbying, campaign donations, and corporate giveaways." He joins us from Washington, D.C. Wendell Potter is with us, a senior fellow in healthcare for the Center for Media and Democracy. For 20 years, he was a former executive at Cigna and Humana, health insurance industries among the nation's largest health insurers. Last year, he left his job as head of communications for Cigna. Earlier this year, he testified on the health insurance industry at a Senate committee hearing. In an op-ed published in the Huffington Post last week, Wendell Potter wrote, quote, "It's tempting to join the kill the bill folks, but it would amount to cutting off our noses to spite our faces." Wendell Potter joins us now from Philadelphia. We welcome you both to Democracy Now! Wendell Potter, let's begin with you. Why are you in favor of the passage of this Senate bill? Why would you like to see this be the new health care reform in the United States?
Well, good morning, Amy, and good morning, John. And I'll need to clear up a misunderstanding because I am not and never have written that I am supporting the Senate bill. So I think we will have a discussion here this morning, but not a debate. I don't really disagree with much of anything, if anything, that John has said or written. What I wrote was that we need to be careful that we don't cut off our noses to spite our faces and fail to get something to the president to sign that will help us improve the health care system in this country. And I said absolutely and explicitly that we need to now focus our attention on the House and see where we can improve the legislation. There are many things in the House bill that is significantly better than the Senate bill. There are some things that actually in the Senate bill that might even be better than the House bill. So what will happen, obviously, is that we'll have a conference committee, a committee of House leaders and Senate leaders that will meet to determine what the final bill will look like. But I've never said that the Senate bill is what we should settle for or accept. In fact, I said at the very beginning of my post in the Huffington Post was that I've gone through all the stages of grief and loss, including anger. But I'm also a realist. I wrote that after the Senate had passed that bill. I can't change what it did. The saying is you can accept the things that you cannot change and change the things that you can. So what I'm going to be focusing on over the next several days and several weeks is to try to see if I can make an impact on the debate going forward and see if we can maybe collectively, working with other progressives, making sure the final bill is one that we can all be proud of, or at least consider it to be a foundation that we can begin to build on.
Wendell Potter, if it doesn't include a public option, as the House plan does, but the Senate doesn't, would you be willing to support it? And what are the elements of that Senate bill that you still think are worth preserving and supporting?
In terms of the public option, I've been a strong proponent of the public option for a long time. And I've noted that back during the campaigns, President Obama, then Senator Obama, and Senator Clinton and Senator Edwards all advocated for it. And it was pretty much created as a concept by someone I've gotten to know, Dr. Jacob Hacker of Yale. It would be a fantastic thing for Americans to have that choice. What happened along the way toward reform in both the House and the Senate is that the public option was weakened so much, even in the House, that it probably would have minimal effect right now. So that's a disappointment as well. So I can't say that the legislation with even the House version of the Senate bill would be something that I would fall on my sword for. I just don't think that it now is as effective as it was, as I originally envisioned it, and certainly as Dr. Hacker did, and as the President did. But there are other elements of reform that really are important. We need to make sure that we've got an expansion of the Medicaid program, for example, to cover many millions of others, to increase the or change the poverty level so that more people can be eligible for the federal program. We need to move forward on defining or making sure that health insurance companies are held more accountable, and that they're required to provide a lot more information than they currently do. And I also noticed that John Walker wrote an excellent post a few days ago, 16 things that he would do to improve the Senate bill. I don't think I disagree with a single one of them. We need to take, again, what is in both versions of the bill, try to combine them to get the best possible bill that we can.
John Walker, your position, you're part of the group that's saying kill the bill, talking about the Senate bill. Why?
Well, we were saying kill the Senate bill. We have endorsed the House bill. It is a dramatically better bill. The Senate bill is just full of failings. One of the biggest is that it works on a state-by-state level, where states run the exchanges, states are responsible for enforcing the regulations. Most states have just failed when it comes to enforcing insurance regulations. Most state insurance commissioners, the ones that actually try to enforce insurance regulations, just don't have a good track record because they lack the money, the know-how, and the power to go up against these large insurance companies. So to think that we can somehow make these small state-based exchanges work as a mechanism for expanding coverage is just fanciful. I don't see how it will work. I don't see any data that would indicate to me that that is a smart foundation to build on. And my fear is what will happen is this program will end up like welfare or even like Medicaid did, where it was a small cutaway program for a small group of lower income, less political